Well, hello everybody. Today, it gives me great pleasure to talk to you about calcium. This has been a point of interest since I was a fellow because we all know that calcium seems to be what's plugging up the arteries. So I have an interest in calcium and with it, vitamin K2. So what is vitamin K2? It's a vitamin that's unheard of, okay? K1 maybe, but K2. So today I'm going to teach you about calcium and vitamin K2 and why I'm so interested in it, because I think that this is a very important chapter in understanding what's causing blockages in the arteries of the body. So let's just dive right into it. There's another study done called the EPIC study, and it showed that for every 10 micrograms of vitamin K2 in your diet that you take, there is a 9% reduction in cardiovascular risk. I'd take that any day. Show me which of my medicines can do that. Very few. So, in the EPIC study, there was a direct correlation. The higher your intake of vitamin K2, the lower your cardiovascular risk. So, if you're consuming 40 micrograms, 9 times 4, that's almost a 36% reduction in cardiovascular risk. The references are all listed, and this was an amazing study. There was another study that was also done in Europe where they showed clearly the amount of coronary calcification. Now, you know that I do coronary scans on all my patients to look for coronary calcification because coronary calcification tells you that you've got atherosclerosis. There's a direct correlation to mortality and heart attacks, and that's been well proven. So now this study showed that there's a direct correlation between vitamin K2 intake and coronary calcification. A direct correlation. This is a beautiful study. It was published in Atherosclerosis in 2009, showing patients with low vitamin K2 intake have the worst coronary calcification, and those with the highest intake have the lowest amount of coronary calcification. There's another Dutch study that was done, and they looked at 180 micrograms of MK7. MK7 is the preparation of vitamin K2 that we use. As I said before, this comes from fermented products. It showed not only cardiovascular risk reduction, but these patients had much better bone density, fewer fractures, and stronger bones as well. This was a 2007 study. Then there were further studies done showing that patients who were given vitamin K2 supplements had improved pulse wave velocities and carotid artery distensibility. So what does that mean? It's improving the elasticity of the blood vessels. How does it do that? Well, obviously, if there's less calcium buildup in that artery wall, in the smooth muscle, which I explained to you before, then that artery is going to be more distensible. So if it's more distensible, so what? Well, what happens is that the systolic blood pressure will be lower because when the heart pumps into a rigid tube, the systolic blood pressure is going to be higher because there's nothing accommodating that stroke volume. But when there's more distensibility, that means there's more compliance in the blood vessel because there's less calcium. It's less rigid. You're going to get a lower systolic blood pressure. We know that systolic blood pressure has a direct correlation to coronary artery disease, cardiomyopathy, congestive heart failure, and total mortality. So what happens to the diastolic blood pressure? Patients given vitamin K2 supplements have a better diastolic pressure as well, because you don't want a very low diastolic pressure. A low diastolic pressure decreases coronary perfusion because coronary perfusion occurs in diastole. So what happens is, if you have vitamin K2 deficiency, you're going to get a high systolic pressure because of the non-distensibility of your rigid tubes, your aorta and everything else. You also get a lower diastolic pressure because there's no recoil of the aorta, and diastolic pressure is caused by recoil of the aorta. So it's a double whammy. You don't want stiff arteries, you don't want calcium. By the way, this process of stiffening of the arteries and losing elasticity starts in your 20s. So I hope I have your attention here. It starts in your 20s. By the time you're in your 50s and 60s, if you have not taken care of your vasculature, you're going to have stiff arteries and calcification. Yes, you may not have had a heart attack yet, but your physiology is being set up to either have a stroke, heart attack, or heart failure. The leading causes of mortality in the Western world. Lots of studies have been done. Now, there's another study with vitamin K2 supplementation. They took a cohort of patients and gave them vitamin K2. They found that the increase in coronary calcium could be attenuated. The control group group showed ongoing calcification because it's so easy to do coronary calcification scores. Here's a nice picture of it. It shows the calcium buildup again, just to remind you all, this coronary calcification was attenuated. You could cause that slope to flatten out with vitamin K2 so you don't get more buildup compared to the control cohort. The group that was given the vitamin had much less calcification buildup. So any opportunity to decrease the amount of coronary calcification and buildup in your arteries and to improve your elasticity and distensibility of vessels, take it. So I give my patients vitamin K2. My diet has to improve too. Eat fermented foods. Fermented foods. The Japanese eat a lot of natto, N-A-T-T-O, right? That's fermented soybeans. If you have a taste for it, then you should have it because that has the highest concentration of vitamin K2. Next is hard cheese, like Gouda. Very high concentration of vitamin K2. Then come other cheeses like Brie and the French cheeses. They have a lot of vitamin K2 in them because it's the fermentation products. The bacteria produce the vitamin K2, then kefir comes in there, sauerkraut comes in there. They also have a lot of vitamin K2, but much less than the first few foods I already mentioned. Our regular meats have MK4, and our eggs have MK4. If you have farm-raised, free-roaming chickens, they'll have vitamin K2 as well. But they have to be free-roaming. They've got to be eating what they would normally eat in their natural life, not the feed that we're giving them. Same thing with the eggs. Any opportunity I get to do that, that's the way to go. Then, worst-case scenario, patients who already have some calcification or are very high risk, I give them vitamin K2 supplementation. So, is there any downside to giving vitamin K2 supplementation? There is one. It does affect your PT/INR if you're taking Coumadin. So if you're taking Coumadin or a warfarin, you need to make sure that you test your PT/INR, because high doses of vitamin K2 will affect it. That's been shown. Other than that, I've not seen any other downside to taking vitamin K2 supplements. How much vitamin K2 do I recommend? 200 micrograms of vitamin K2 on a daily basis. Now, let me talk a little bit about something else. Remember I told you I started off by saying there's a correlation between my patients who have diabetes and osteopenia, and they seem to have coronary artery disease. Well, let's see if there's a link here. We know that vitamin K2 also affects insulin sensitivity, and I'll show you the references for this as well. If we induce vitamin K2 deficiency in a patient by changing their diet, it produces insulin resistance. When you supplement them with vitamin K2, 200 micrograms of MK7, we show that insulin sensitivity gets better. Remember my previous talks. I talked to you about insulin sensitivity in patients who have insulin resistance. Just by giving them vitamin K2, I'm also improving insulin sensitivity. Now, why is that? What's that got to do with this? Vitamin K2 is found in high concentrations in the body in certain places. Saliva has an extremely high level of vitamin K2. So what's that doing in the mouth? Well, guess what? I've got teeth. Vitamin K2 in the saliva causes me to deposit dentin. So the higher my vitamin K2 levels in my saliva, the better my teeth are going to be. Is this all making sense now? If you have vitamin K2 deficiency, you're going to get dental caries. This has been directly correlated. Weston Price, the dentist, clearly showed that he was curing the worst dental caries by giving patients vitamin K2. He called it factor 10 at the time. He didn't know it was vitamin K2. He would cure all these people's bad dental caries. He wouldn't pull teeth. He'd just give them this, and all of a sudden the caries would get better. This is amazing stuff. So vitamin K2 in the saliva is there for a purpose. The highest concentration in the body is there because it wants to keep good dentin. Number two, it's in the pancreas. There's a very high concentration of vitamin K2 in the pancreas. What's it got to do with the pancreas? It's got to do with insulin sensitivity. That's why when you give vitamin K2, you're boosting pancreatic function and preventing that oversecretion of insulin, that unregulated oversecretion of insulin. The incretin response is attenuated when there are good amounts of vitamin K2 inside the pancreas. Joint disease, I think I already touched on that. If you don't have vitamin K2, you're not going to activate the matrix proteins in your bones, and therefore you're going to get osteopenia. There are lots of references for this. Now there's another one, Alzheimer's disease. What's that got to do with it? Again, we're not 100% sure, but remember, the vasodilatory capacity of your capillaries in your brain is very important. When I do functional MRI studies, you look at the flow of blood in different parts of the brain. Instantaneously, the flow increases here, decreases there. That's my brainwave activity. How does that happen? Through vasodilation. This ability of the microvasculature to automatically vasodilate and vasoconstrict is controlled by vitamins in your blood vessels and smooth muscle cells. A further study showed that overall, patients with high levels of vitamin K2 had a 30% reduced risk of cancer. As I mentioned before, natto, hard cheese, butter, liver, and cod liver oil all have very high concentrations of vitamin K2. Then prostate cancer. There was a study showing there was less prostate cancer and less spread of cancer in patients who had the highest levels of vitamin K2 in their bodies. Then osteodystrophy in renal failure patients. One of the biggest problems with renal failure patients is that they get calcification of non-osseous structures. When they come to me, I see the coronary calcium score is extremely high. The carotids are calcified, the aorta is calcified, and the aortic valve is calcified. Again, those patients used to be given calcium. We don't give them calcium anymore because the mortality is very high. We feel that this is secondary to two factors: vitamin D deficiency and vitamin K2 deficiency. Now, I've got to tell you about vitamin D because in order to get the optimal function of your vitamin K2, you also need vitamin D. Vitamin D goes to that same matrix protein and then K2 comes along. They work together on the matrix protein, so you need good levels of vitamin D as well. That's why we give vitamin D to our patients. Vitamin D's job in the body is twofold. One, it increases the absorption of calcium from your gut. That's what vitamin D does. But vitamin D doesn't then take that calcium and do anything else with it. That job belongs to vitamin K2. Vitamin D's job is simply to absorb the calcium into your body. Where that calcium goes afterward, whether into a vascular structure or into bone, is not determined by vitamin D. That's why, if you have a patient with osteopenia, just giving them vitamin D alone isn't really helping them. But if you look around, everybody's on calcium supplements and vitamin D supplements, yet they're not on vitamin K2 supplements. This experiment has gone on long enough. All your foods are vitamin D supplemented. Vitamin D is in your milk, your orange juice, and just about anything you pick up. Yet we have this epidemic of 25-year-olds coming to me with osteopenia. Oh yeah, I have osteopenia as well. I'm surprised. You're drinking all this stuff with so much vitamin D and calcium. Everything is calcium fortified, and yet you have osteopenia. Why? Because they don't have the right chemistry. There you go. By the way, vitamin K2 deficiency has also been linked to fertility problems. In kids, the development of the face, the arch, and the nose is also related to vitamin K2. Again, Weston Price nailed it down. The mothers and children who were vitamin K2 deficient had premature calcification of the cartilage in their faces and nasal bridges. Therefore, they developed small jaws and upper airway obstruction. The question is, why did these kids develop this? Because they didn't develop their faces properly due to premature calcification of the cartilage. Everything closes after a while, and that's it. The cartilage can't continue developing because it's been calcified. So you get narrow arches. They say you can actually detect some of this in utero, that this baby is probably vitamin K2 deficient based on facial structure. This is a very exciting area as well. It shows that the mother's nutrition is exceedingly important during pregnancy to avoid narrow jaws, mouth abnormalities, and these issues. Tooth decay. I already touched upon the very high levels of vitamin K2 inside your saliva. You want to keep that going? Patients with bad dental caries can get low-grade endotoxemia because the gums become unhealthy. That provides a direct route for tiny bacterial products to enter the bloodstream. These products are called lipopolysaccharides. They get into your bloodstream, and they're the ones that displace cholesterol from the LDL molecule, creating small, dense LDL. You know that it's small, dense LDL that causes atherosclerosis, not LDL itself. LDL becomes small and dense because it picks up endotoxins along the way, since endotoxins can't free float in the bloodstream. We always look to see what the cause of small, dense LDL is, chase that down, and improve the patient's health. So gum disease is very important. Patients take these mouthwashes with all those chemicals in them. That's the worst thing you could possibly do because you're killing off the good bacteria in your mouth and replacing them with probably the hardiest ones around. Then you wonder why there are more dental caries. It doesn't even do anything for your breath because bad breath comes from something much deeper. So I'm not in favor of those mouthwashes. The better thing to do is to take a good probiotic and vitamin vitamin K2 supplementation, you'll have a much better oral bacterial flora, and of course your dentin will be very good too. There's also data showing a direct correlation between dental caries and stroke. In closing, I just want everyone to know that vitamin K2 is probably a small, unheard of molecule, but it is exceedingly important in our physiology. When I, as a cardiologist, see all this calcification in coronary arteries, I'm always asking the question, why? Where did this calcium come from? What's it doing where it shouldn't be? I think that those patients should all be on vitamin K2 supplements. Many of you have been asking, Dr. J, why are you putting me on vitamin D and vitamin K2? I came here because I've got a blockage in my artery. Well, this is the answer.
If you like this video, then I strongly recommend this one for you. But if you want to see the whole series, please click here.